A couple of cases. I'm sure those of you who are in areas where the prevalence of COVID is pretty high have seen these cases, but if you haven't been hit yet, so maybe something that to be aware of. So,
and Victoria, you're at Montefiore in New York, right?
I'm in New York, so
you're at the epicenter.
We are at epicenter, and unfortunately, Montefiore is the center of the Bronx for all the COVID patients. So we've been hit pretty hard. So there, there's the more cases we have, the more interesting findings kind of come out. But I just wanted to show a couple of interesting cases that we've seen. So this patient was not known to be to be positive. She just came in with several days of abdominal pain. So she had absolutely no symptoms related to coughing or anything like that. So no classic symptoms. She just came in with abdominal pain. So, as we move through her abdomen, you can see very clearly she has very classic, these large areas of hypoenhancement. So, our initial thought, of course, jumps into pilo versus infarcts. My thought was it's an infarct because they're so sharply demarcated, although obviously can't always tell them apart. And, you can't really see on the axial very well, but on coronals, you can see, can you see it, Artie?
Yes, a thrombus in the renal artery, yes.
Right, so you can see like a nice thrombus in the renal artery. So, there's no differential. These are just infarcts. There's no other findings, but when you look at the lung bases, patient has, these ground glass opacities. A lot of them are kind of in the peripheral distribution. Now, in any others, if I was shown this case, a year ago, even 5 months ago, this is a very non-specific pattern, of course, but in a situation where the prevalence of COVID is so high, this is pretty much COVID. Ground glass opacities, a lot of them are peripheral. Now, classically, we also want to see some of them to be rounded, as you can see here. So the patient was tested and confirmed to have COVID. And this is how this patient presents. So even though there are clearly findings in the lungs, she has absolutely no symptoms related to the lungs. But she just presented with this, just thrombosis, random thrombosis of the left renal artery. A companion case to this.
Wait, Victoria, I have a question for you.
Yes.
And maybe you're going to address this later, but we were talking about, like, a lot of these patients are having like a prothrombotic situation. And I was just wondering if if it's related more to arterial versus venous. Like, we're getting a lot of DVT studies. I know some patients have massive PEs, but like, do they get more arterial or more venous? And my impression was that a lot of them are also getting like microangiopathy.
Right. So this is kind of let me show the second case, because they're kind of the same. So just as a background, we've seen a lot of cases where patients come in with abdominal pain, and just abdominal pain, and there's nothing on CT of the abdomen pelvis, but the lungs are clearly COVID. So that's at least in our experience, that is a more common thing that we see or saw. Where just tremendous abdominal pain, really we don't see a lot of findings except for the lungs. But recently we've seen several of these patients. This is another patient. So this patient actually has a PE, you can see right here. So she came in with I forget if she had, I think she was shortness of breath but more like related to PE. This is her lungs. Again, very classic ground glass opacities. Many of them are peripheral. And she had a PE, but she was admitted. And then a couple of days later, she started having a cold extremity. So as we move down, you can see that her aorta has this large clot extending into the iliac arteries. And then there's some reconstitution, as you can see here. And then as we move down, the right extremity is fine. Notice how there's really not much in terms of, this is not a vasculopathic appearing patient. This patient has, pretty normal vessel actually, which is, unusual for our patient population. But notice how at the level of the distal popliteal on the left, there's just no vascular flow anymore. So her entire left extremity is completely devascularized. Let me see if I can show this without flashing patient's name. Let's see. The reconstruction, Artie?
Yes, sorry.
Okay, but no, it's just I've never tried this. Share only part of the screen, so I want to make sure it actually works. But you can see this is the MIP image, so you can see the right lower extremity is fine, but in the left, you can see there's just. I'm just gonna bring this up a little bit. You can see just a trickle in the distal thing, and it's just the entire left lower extremity is gone. So I try to look, at some of the data in terms of vascular, and it seems like arterial thrombosis is more prevalent. And there's some theories about virus damaging the endothelial vascular cells, and some of the theories where these ground glass opacities that we see is really related to microhemorrhages in the lungs, among other things. So we have seen these and this is not the only two cases we've seen where they're just tremendous, what do you call it? Just random arterial occlusions. I just want to show the other findings in the lungs in this patient. There you go. So you can see very, very classic, peripheral ground glass opacities with some of this, with this crazy pavement pattern. Some of them have actual consolidations. But, this is quite classic at this point. So just I wanted to bring up these even though there's a lot of talk about chest and chest findings, there are some findings in the abdomen. I actually spoke to my neuro colleagues, and they're beginning to kind of put together data on the findings in the brain, which also related a lot to vascular micro events. So
I wonder if the severe abdominal pain is some kind of like microvascular event in your GI tract that we're just not seeing.
Probably in a couple of the cases, when you go back, you can see like some. We have one case where there was like this little ground glass, non-specific something around the celiac, and that's the only finding in addition to the lungs. So that's what I'm thinking. That's probably some sort of microvascular events. Maybe even just like if you have microvascular events in the celiac plexus, and that's what's giving you abdominal pain. But quite a bit of patients present with abdominal pain, and interestingly, even though the lung findings are pretty prominent, they have no pulmonary like issues. So it's a very strange disease, as we all kind of know. So those are
Thank you.
Yeah.